Hello, everyone, and welcome to another episode of Humanitarian Horizons. Christina DiArcangelo Unveiled. I am your host, Christina DiArcangelo, and today we are going to have a conversation that may make some people uncomfortable, but it's one we need to have. We need to talk about vaping. Not from the perspective of politics, not from the perspective of business, but from the perspective of our children, our families, and our responsibilities as the parents, as an adult. Over the past several years, we've watched the vaping become normalized among young people. In too many schools and communities, nicotine vaping has shifted from something viewed as risky to something some students perceive as a commonplace. As parents, educators, healthcare professionals, advocates, and community leaders, we have to ask ourselves the following: how did we get here? And perhaps more importantly, how do we fix this? This was never the plan. Let me be clear. Nicotine vaping products were never intended for children. No responsible manufacturer, healthcare professional, regulator, or parent should want a middle school or high school student using nicotine products. Children's brains are still developing. According to the U.S. Surgeon General and the Centers for Disease Control and Prevention, CDC, nicotine exposure during adolescence can affect attention, learning, mood, impulse control, and it can also increase the risk of future addiction. This should concern every adult. One of the most troubling trends isn't simply that young people are vaping. It is that some are encouraging others to participate. Some students pressure classmates to buy products for them. Some ask them to hide them. Some convince others, everyone's doing it, so why aren't you? This is not harmless. That is called peer pressure. And peer pressure can quickly become coercion when a child feels that they have to choose between doing what's right and being accepted. No friendship should require another child to break the rules or take risks. Will friends don't ask friends to jeopardize their future. Parents have a critical role here. This is where I want to speak directly to the parents, okay? Our children learn so many things from teachers, coaches, mentors, things online. But there first must be lessons in integrity, accountability, and personal responsibility becomes and begins at home, in my opinion. Parents cannot control every decision their child makes. Adolescents develop independence, spend time with peers, and sometimes make choices we do not want them to make. But parents can influence their children about how to think what is right versus wrong. They can teach that if everyone is doing it, it's not the reason that they should be doing it also. Okay? Let's not be a leader. Let's not be a follower, but instead be a leader. That's what we should be messaging. They can model honesty, accountability, and the respect for rules from the parental side immediately. You don't have to wait to do this. This should have automatically already been doing and happening in your home setting. Really, honestly. Parents can create an environment where children feel safe talking about difficult situations without fear of being ignored or dismissed. If we stop having these conversations with our children, someone else will shape our children's values. Accountability is a community responsibility, in my opinion. Schools have a role, communities have a role, healthcare professionals have a role, law enforcement has a role, industry has a role, and parents have a major, major role. When a young person is caught with a vape, The response shouldn't just simply be a punishment. It should also be education. We should be asking, what led to this decision? What support does the student need? How can we help them make different decisions next time? Accountability is about helping young people understand consequences while giving them the tools to make better decisions. There's another consequence that deserves attention as it relates to vaping. The misuse of vaping in minors has affected the public perception of the broader cannabis industry. In many jurisdictions, regulated cannabis businesses are required to follow strict rules regarding age verification, product testing, packaging, labeling, manufacturing, and advertising. Many companies work diligently to comply with these requirements and do not market their products to minors. When children obtain or misuse vaping products, people become concerned. Obviously, the public is the number one area where people become concerned. It also extends beyond the nicotine devices and influences perceptions of vaping technology more generally, including products intended only for adults. This can complicate the public discussions about a legitimate medical cannabis industry as far as the medical programs are concerned, harm reduction strategies for adults, and responsible regulation. These are all separate issues. Protecting children from nicotine and ensuring adult access to regulated products where lawful should not be viewed as competing goals, in my opinion. Both require oversight and education. We should be teaching our children something very, very simple. Character matters. Integrity matters. Doing the right thing when no one is watching matters. If someone pressures you to buy a vape, walk away. If someone tells you that it's harmless, ask questions. If someone says, well, everyone else is doing it, remember that popularity has never been a standard for making good decisions. The strongest people are often the ones who have the courage to say no. It's not popular to stand up for things you believe in when others don't, but you still need to stand up for what's right. Parents, please do not assume this conversation is happening somewhere else. Have it at the dinner table, in the car, after school, before bedtime. Ask your children what they're seeing. Ask them if they've ever been pressured. Ask them what they would do if the situation arose in front of them. How would they handle that? Do role playing. Listen without immediately judging. Young people are more likely to seek guidance from adults who are willing to hear them. And if your child makes a mistake, use it as an opportunity to teach, not simply punish. Every generation is facing new challenges. This is one of ours. The goal isn't to create a fear. The goal is to create awareness, to help young people understand that every decision has consequences, to remind parents that their guidance still matters, to encourage schools and communities to work together, to ensure that no child believes that using nicotine is just simple and a normal part of growing up, because our children deserve better. They deserve adults that are willing to lead, who are willing to listen, who are willing to teach them integrity with that will always last with them throughout their lifetime. Against peer pressure. Thank you for joining me today on Humanitarian Horizons. Christina DiArcangelo Unveiled. If this conversation resonated with you, I encourage you to share it with a parent, an educator, a coach, a healthcare professional, or a community leader. Meaningful conversations are one of the most effective ways to prevent harm before it begins. Until next time, remember, the future isn't shaped by the choices adults make alone. It is shaped by the values we help young people carry forward into adulthood. I am Christina DiArcangelo, and thank you so much for listening.